we're going to discuss a clinical trial that is ongoing right now, evaluating the use of DNA vaccine at eliciting immune response in patients with prostate cancer. Essentially, the hypothesis or the question that's being asked by the study is whether it is possible to use a naked DNA vaccine with GM-CSF as adjuvant to elicit an immune response in prostate cancer patients, an immune response to PAP, which stands for prostatic acid phosphatase. This is a tumor antigen that's found in prostate cancer patients. The patients in the trial, they had prostate cancer, but the prostate cancer was ablated either by resection or by radiation. However, the patients have increasing PSA levels. So because there's increasing PSA levels, the patients are believed to have minimal residual disease or micrometastatic prostate cancer, which is causing the increasing in PSA. This group of patients is called D0, and they're at a very high risk of relapse. So the design of the study had two parts. The first part, aim of it was to determine maximal tolerated dose, and then the second part is to actually look at immune response. So the way it was designed was 3 patients per group. So there was 3 groups, and in each group there was 3 patients, so 9 patients in total. The first group received 100 micrograms of DNA with 200 micrograms of GM-CSF. The second group received 500 micrograms of DNA, 200 micrograms GM-CSF. The third group 1500 micrograms of DNA and 200 micrograms of GM-CSF. All of this being performed subcutaneously, and the administration was done once every 2 weeks for a total of 6 vaccinations, so in total 10 weeks. So once the patients were treated, if there's a dose-limiting toxicity found, then in one of the 3 patients, then another 3 patients is added to the group in which there was dose-limiting toxicity. Now for part 2, the maximal tolerated dose identified in part 1, you take that dose and you add 16 patients into the group. And this way you're looking for immune response, if there is an immune response in that study. In that subset. So essentially, like we said, the protocol is you vaccinate once every 2 weeks, total of 6 vaccinations, and assess immune response before immunization at week 4, week 8, and 12 weeks after. Here is the dosing schema. Again, like we said, it's 3 doses, 100 micrograms, 500 micrograms, and 1500 micrograms of the plasmid, injected once every 2 weeks for a total of 6 injections, all the time using 200 micrograms GM-CSF. Here's another picture of the dosing schema. Blue being the injections, the vaccination, the red arrows being the immune assessment. And here's a more detailed breakdown of the treatment plan. Essentially, it has a very typical clinical trial design. So in conclusion, the fact that this study is allowed is telling us, and is being conducted today, is telling us that it is possible to do DNA vaccination without using the specific DNA delivery device. This was all done, the injections were done intradermally in this study. Ranges of DNA for administration in this study, 100 to 1500 micrograms of the naked DNA. GM-CSF, the dosage was used as a constant dosage of 200 micrograms. This was injected at the same place that the DNA was injected in. Here in this study, the doses were done once every 2 weeks, total of 6 doses, and the study had this really nice adaptive design component in which the first part you find the maximal tolerated dose, and then the second part of the study you increase the numbers and you look for the immune response. This study is ongoing right now, and we can't wait to see the results.